morning, the most news in the morning, period. Weekdays 6 Eastern.
People still take a little getting used to have a robot operating on them, whether it's their heart or their prostate, but this is an option for a lot of patients out there. About 1 in 6 men are going to be diagnosed with prostate cancer and in their lifetime. And the question is, what exactly do you do about it? We decided to take a look. Here's what we found.
These are the instruments, and they kind of slide right into the arm of the robot.
It looks like a video game. But what you're watching is Dr. Nikhil Shah delicately remove a prostate. He's seated 5 feet away from the patient. He uses robotic arms and a joystick to perform the operation, and he doesn't even have to scrub his hands.
They take away some of the impreciseness of the human hand. I'm able to use my hands and control the instruments, but I'm able to do them more delicately.
It's called robotic surgery, and over the last several years, it has become very popular. Patients often traveling hundreds of miles to have this type of operation performed. Like Tony Pouncey. He's 60 years old, he's healthy and active. But a few months ago, during a routine visit, he got the shocking news: prostate cancer.
Right away, I kind of freaked out a little bit and got on the internet, called around to find out what was out there for me.
So Mr. Pouncey had a tough decision to make. What exactly to do about his prostate cancer and where to have it done. What he decided was to come to this operating room and have a robotic prostatectomy. Let's take a look.
So we put a total of 6 ports across his belly. They go through, but they don't do a lot of damage as they go through the tissue.
Admittedly, robotic surgery is less tested, but it also has proven advantages: less pain, fewer side effects, less blood loss. It's pricey, costing up to $15,000, not always covered by insurance, and dangerous if not performed by a properly trained surgeon.
I worry about that a little bit. I think that when you have such sophisticated technology and doing such complicated surgery, ask questions of the people there. What kind of experience does your doctor have?
But the experience has been outstanding for Tony Pouncey. Only weeks after his operation, he's back to his active lifestyle. And best of all, he's cancer-free.
This particular robot's called the Da Vinci robot, and this type of operation is offered in 47 states plus Washington, D.C. now. So the demand has really gone up, Rob. It is not for everybody. People who are very overweight, people who've had previous operations, for example, may not be candidates, but it is growing in popularity.
It's just startling to me, the advances we've made in medicine in the past 50 years, Sanjay. Some news came out yesterday regarding the screening of prostate, somewhat controversial. What's being recommended now?
Well, you know, when it comes to screening, really, you're talking about a risk-benefit ratio to screening. Is it going to provide enough benefit to recommend that sort of screening test for everybody? With prostate cancer specifically, so there's an organization that recommends that the PSA test, which is one of the screening tests, not be done for men over the age of 75. Now, not everyone agrees with that, but the idea is that prostate cancer can be a slow-growing cancer, so if it's not diagnosed until after you're 75, it may not affect you in your lifetime. What it really needs to be based on, as well as you might imagine, Rob, is your overall state of health. There are 75-year-olds who are going to live a long time. They should probably get the test, but if it's someone who's sicker or has more health problems, maybe not. So it's a decision to talk to about your doctor.
Just real quick, on the low side note, how old or young should you be to first get your first screening?
Well, you know, PSA test typically around 40. It can change depending on your family history if you have some other risk factor for it.